Hello and welcome. My name is Bryana Gregory, pharmacist and physician liaison with Physicians Preference Pharmacy. Thank you so much for tuning in today as we are going to discuss one of our compounds on our formulary called nitazoxanide. So, nitazoxanide is something that is a newer add to our lineup here at Physicians Preference Pharmacy, and you may not really have heard your providers talk about it. Sometimes when I do these presentations, I will focus more on the indication or the reason why we use the prescription drug. Sometimes I will focus more on the drug itself. Of course, being a pharmacist, I think it's very important for us to understand where the drug came from, how it works, so that we can better understand those that we can use it in. Today, it's going to be a little bit of a blend of both. And I'm going to tell you, forewarn you, if you are eating dinner while you're watching this, you may consider doing so with caution. There are some little bit more graphic images, but I've tried not to make it too graphic per se. So what we're going to do is we are going to start out with a little bit of an introduction, of course, of who we are at Physicians Preference Pharmacy, and then we're going to dig into nitazoxanide, what it is, what we use it for, and I'm going to focus on three main conditions that we use nitazoxanide in. So if you haven't heard of this, it is an old drug, but we are starting to use it more and more for different uses. So there is kind of some buzz around this drug right now. Starting off with a little bit of a brief introduction about the pharmacy. If you currently are a guest of the Hotze Health and Wellness Center, then you obviously know who we are, but you may not know that we actually work with physicians all across the nation. So we fill prescriptions for guests all over the place, and we have the privilege of doing that because we do things a little bit differently at Physicians Preference. Just as a recap, we are a non-sterile compounding facility, which means that we focus on non-sterile dosage forms. Sterile dosage forms are dosage forms or types of medications that are prepared in injectables, IVs, or ophthalmics, which means that they go in the eyeball. Of course, we specialize in bioidentical hormone replacement therapy and immune modulating compounds. So, even though what we're talking about today wouldn't necessarily fall into either one of those categories, nitazoxanide has a very interesting mechanism of action, meaning how it works in the body and not so much on the issue that we are addressing. And so I'm definitely going to unpack that. This PowerPoint is a little bit more clinical information heavy than I typically present. So be sure that you strap in. I'm going to keep it a little bit shorter, but it is content heavy. So I really want you to grasp the power of what this medication can do. Now, all of our preparations, including nitazoxanide, are always going to be free of any of those unnecessary dyes, binders, fillers, artificial sweeteners, lactose, which is a pretty cheap filler that some pharmacies still use surprisingly, and then parabens, which are just a general description for ingredients that actually disrupt hormone function. If we're treating hormones, we obviously don't want to disrupt them. Dosage forms that we focus on today, we're going to be talking about capsules. We also make suspensions, tablets that dissolve under the tongue, which are referred to as sublingual, topical and vaginal creams, usually for hormones, and then also nasal sprays as well. Now, we do ship directly into 49 states. That excludes Alabama. We still have folks that we serve in Alabama. We just can't ship directly to their home. And if you're here, you probably know and probably agree that we oftentimes believe that prescription drugs are being overprescribed, kind of in a band-aid method. Instead, what we want to do is address the root cause of the issue at hand, which is causing symptoms, and then work backwards from there so that we can more effectively treat what is actually going on in the human body. Lastly, we are PCAB accredited. So PCAB is the Pharmacy Compounding Accreditation Board. And what that is an accreditation board that pharmacies can voluntarily seek that accreditation through inspection and meeting more rigorous standards than what the State Board of Pharmacy requires, which is who actually regulates us, is the Texas State Board of Pharmacy or any other state board of pharmacy that we are licensed in their state. So we actually have to abide by 49 different state boards of pharmacy. So we take pride in that because it means that we have stricter standards. We perform both on-site and off-site third-party testing to ensure your medication. So over the past couple years, we have added quite a few interestingly named drugs onto our formulary. That would include rapamycin and amlexinox, and I would put nitazoxanide in there. So you may hear this pronounced a couple different ways. Nitazoxanide, that's not correct. It is nitazoxanide. So I just put this on here because it's kind of fun. We hear it mentioned and pronounced all types of ways. Okay, so we're here to talk about nitazoxanide. So we are going to start with its history. Again, I apologize for some of these photos. We're going to go back to the 1970s. So, where drugs are initially found or developed, or there's a certain area of study that we tend to be interested in, said population, is it humans, is it animals, is generally where the interest for these types of drugs starts. So, back in the 1970s, nitazoxanide was actually developed with the intention of making it a veterinary oral antiparasitic, meaning it works against parasites. And parasites is actually just a general term for something that requires a host that it must live on to stay alive. So sometimes that can be just bugs, what we consider to be bugs. It can be worms, which is usually what we're talking about when we talk about parasites, but not necessarily. To some extent, viruses and bacteria almost work like that because they require a host to function. They can't just live out in the open forever. And that's why they need to use the human body as a vector to use our nutrients so that it can survive. So initially, we were looking at this for veterinary use for protozoal and anti-helminthic activity. Now, what that means, there's a lot of big words throughout this presentation, but we're talking about parasites, protozoa, which is kind of the initial parasite if you go way back into prehistoric days, and then anti-helminthic. Helminths are worms, so that's what we're looking at right here. So looking at for anti-worm activity as well. Now, about 10 years later, the efficacy was discovered against tapeworms in humans, and this is what a tapeworm looks like or can look like when it's extracted out of the human GI tract. It's pretty gross. They get to be very long, depending on how long they're in there and how many nutrients they're really stealing from the human body. Then fast forward to the 90s, we start to find some efficacy of antiviral activity, part of what we are going to be talking about in this presentation today. And then in 2002, nitazoxanide gains its FDA approval of the brand name of nitazoxanide called Alinea. So Alinea is usually what is getting prescribed if someone gets a prescription for nitazoxanide. Now, we compound nitazoxanide at the pharmacy, and pharmacies don't compound brand names because that brand name drug belongs to the drug manufacturer. So, as with many drugs, they're developed as a brand name. They sit there on their patent for X amount of years, and then another company can come out with a generic, which would be nitazoxanide. So its initial indication in 2002 through FDA approval was diarrhea caused by a couple of these bugs, one being Giardia, which is what you're looking at here. If you ever had a dog that goes swimming in an open lake, that is an extremely common way for them to get Giardia, and that's what this looks like here. So Giardia lamblia and also Cryptosporidium parvum, and that's in adults. So this is, it got this indication to be treated for these two issues in adults, but also really anyone over the age of 1. So children over the age of 1 all the way through adulthood. All right, let's unpack how it works. So, AKA mechanism of action, what is going on with nitazoxanide that allows it to fight off these types of infections? Now, if you're thinking, well, I don't usually go swimming in open lakes and I've never heard of Cryptosporidium, chances are you're probably not going to be using it for that. So just hang tight on some of the other ongoing uses that we have for it. But as I mentioned, Alinea is the brand name. Nitazoxanide is the generic. If you were to go to a retail pharmacy, they would probably receive it in a bottle like this that just has the regular tablets. This is a 500 milligram dose, which is different than what we compound. The other thing is that, to my knowledge, Alinea used to be available, or nitazoxanide, as an oral suspension, so a liquid suspension, which is generally more flexible, especially if you're treating kiddos because they require a much lesser dose and probably for a less amount of time as well. That oral suspension, to my knowledge, has been on back order for quite some time, is highly limited, and it's arguable it might even be unavailable now or going forward. So again, the FDA approval came in the early 2000s for diarrhea caused by Giardia and cryptosporidium, like we talked about. But when we talk about how drugs work, pharmacology can be a really confusing area to learn and to talk about. And that's really what pharmacy is based off of, is pharmacology, which is looking at these chemical structures and without seeing a drug name, being able to understand what that activity is going to be of that chemical structure. So this is the chemical structure of this drug. What is very interesting about a lot of drugs that carry antiviral benefits or antiviral properties is their chemical structure, their chemical backbone looks really similar. Whether we're talking about hydroxychloroquine or methylene blue or chloroquine or niclosamide or nitazoxanide, a lot of them share a lot of commonalities in this backbone with just a few variations, meaning they're maybe missing a carbon or an oxygen, and that makes it a completely different drug. So what we're looking at here are chemical structures in the drug class thiazolide. So these are thiazolide drugs. It's a thiazolide antimicrobial, so it works against microbes, works against the bugs, and works against protozoa. Again, protozoa is, if you're looking back in the dinosaur days, initially life was built off of protozoa. So very small celled organisms. Now, nitazoxanide is something that we refer to as a prodrug. So a prodrug is a drug that you take, let's say it's in tablet form or capsule form or really whatever it is, and then your body breaks that down, generally in the liver, to a different type of compound. So what you take gets very quickly metabolized or broken down into something else, and that something else is what the body is actually using to help treat the disease, fight off the infection, etc. And that's what I've illustrated here. So the drug you're taking is nitazoxanide, but what's doing the work is tizoxanide. So it gets very quickly metabolized to tizoxanide. So this is the prodrug, which is kind of like a pre-drug. It gets converted into the actual drug that is active. And that's what is the metabolite that is circulating around. Now, a lot of big words here too, but it's just the mechanism of action. It's what it does. So how it actually works is that when you take nitazoxanide, it inhibits or decreases pyruvate ferredoxin oxidoreductase, which we're going to just affectionately call P4, which is an enzyme. An enzyme helps something in the body do something else, basically. It's kind of like a carrier. So this enzyme is essential for anaerobic activity. And what that means is that it helps the body function better and helps any bugs that are living in an area of low oxygen function better. So there are, let's say, bacteria, for example, that love to live in oxygen. There are bacteria that cannot survive in oxygen. So anaerobic is low oxygen. So these bugs, let's say, that like anaerobic areas, like let's say the gut would be an anaerobic environment, they rely on that type of metabolism to actually function well. So said bugs, said viruses, said bacteria, for example, they use this enzyme, which is essential for them to be able to create energy. And that goes for both bacteria and parasites. So it basically disrupts those bacteria and parasites from functioning like they should. Now, nitazoxanide we would put in the repurposed drug category, which we've talked about that before. Mebendazole, ivermectin, rapamycin, methylene blue. These are all drugs that we have that we consider to be repurposed drugs, which means that they were initially developed for one reason and now they're being used for one or more other reasons. Okay, so these are some of the other reasons. We have a broad spectrum of nitazoxanide, meaning it does a lot of things. So we talked about its protozoal use. We talked about its anti-helminthic, which is worms use. We talked about it being antimicrobial, which can be thought of kind of as the mycotoxin producing guys or the bacteria. And then also it has some antiviral function. Now, there's a lot of big names on here as far as what these species are, but you might actually recognize some of them. So some that we talked about for initial approval were those protozoa, right? So it was the Giardia and the Cryptosporidium. You may have also seen of or heard of H. pylori before, so Heliobacter H. pylori. That's one that generally lives in the stomach, and this is one of the smartest bacteria out there. It's a nasty guy that will strip the mucosal lining of the gut. It'll wreak havoc on the stomach, cause a lot of pain. It oftentimes goes undiagnosed because, for whatever reason, docs don't really think to test for it. It can live in the lungs, and it is heavily dependent on the pH of the stomach. So when you start taking medications, like let's just play this out for a second. Let's say that someone has digestive issues. They have GERD or heartburn or that brash or the regurgitation that causes that feeling of burning throughout the throat after they eat something that might be partially coming back up. What they give are medications to alter the pH of the stomach. Now, one of the biggest problems that I see for people that are prescribed those medications is they're indicated to be on them only for 2 weeks. I've hardly met anyone that's only been on it for 2 weeks. They're usually on it for decades because their doctor never takes them off that. The problem with that, these are called PPI drugs. Like, for example, we're talking about omeprazole, drugs like this. If they alter the pH of the stomach, then what they're doing is cutting down the production or the function of stomach acid that its intention is to be there and actually to metabolize your food. So if you can't metabolize the food, you don't absorb the nutrients from the food, you technically become malnourished, and that doesn't even mean you look skinny. You might be overweight and malnourished because that's pretty common too. But that allows something like H. pylori to just love that environment. And so it will wreak havoc on the stomach, and it is very good at burying itself into the tissues and doing so very deeply and hiding from anywhere that it can be tested. So when you do a typical test to screen for H. pylori, you may show up negative, but actually still have recurring issues from H. pylori. So this is a real tricky one. Also, when it comes to treating it, there are several things that are involved, including courses of antibiotics, which if we don't have to be on those, we don't like to. Here is an area where we would be more familiar with, of course, are the viruses. So flu A and B, RSV, influenza, so parainfluenza, coronavirus, obviously that's SARS-CoV-2, that's COVID, rotavirus, norovirus, and then Hep, so hepatitis B and hepatitis C, which affect the liver. And nitazoxanide does even more than that. The reason that I've actually listed these out here is you may be familiar with some of these markers if you've had inflammatory markers measured in the office by the doctor and you're trying to figure out broader picture what's going on. When we look at inflammatory markers, we can gain a sense of what may be going on at a root cause if we know which ones are elevated or which ones are deficient. So nitazoxanide may have an impact on both, and I'm going to unpack this, endosomal and non-endosomal COVID-19 cell fusion and entry. Wow, that's a lot. What happens when a virus enters into a cell is it doesn't just walk in the front door. What it does is it either sits on the center, or excuse me, sits on the outside and then gets engulfed, which is more like endosomal, or it has a more like a puncture entry, which is not getting wrapped up into an endosome and engulfed. So when you're talking about how a virus enters a cell, a lot of times it's doing that engulfment to bring it in, which is how it keeps it safe upon entry from getting recognized. And it's kind of like a disguise, like it's wearing a mask, so it's allowed to go inside. So what's interesting about that is regardless of how that COVID-19 virus gets in the cell, nitazoxanide can still work on it. It can also help to inhibit or keep down or tame down these inflammatory markers here. TNF alpha can be elevated in a lot of inflammatory issues. It also plays a role in cancer because it stands for tumor necrosis factor alpha. And then your interleukins and just all the numbers that fall behind them. These are inflammatory markers. It can also block the maturation process of viral proteins. And so if the virus can't make proteins and can't replicate and can't mature, then it can't infect. It has a low potential of developing resistance, which is highly important. The most common type of resistance that we know about is antibiotic resistance, which means that if you don't take that antibiotic like you should, or if you just keep taking it and taking it and taking it, the bacteria that you are trying to fight off with that antibiotic gets smart. It begins to understand what the drug is that it's being exposed to, and it will find a way to make itself resistant to it so that you no longer respond. That's why we're very cognizant about antibiotic resistance because we don't have an unlimited supply of antibiotics. So if a doctor, for example, keeps prescribing you one antibiotic after the other, after the other, after the other, eventually you're going to run out of antibiotics if you truly needed them. And they all only have certain types of mechanisms of how they work. So we need to be sure that we get crafty with switching that up. Hopefully, you're not that reliant on antibiotics. But some cases, like Lyme disease, for example, it's a heavily antibiotic dependent condition. So we have to be clear and very wary of that. So we don't want to take anything that's going to have a high resistance profile because then we run out of options. Also, it does upregulate something called protein kinase R, which is just going to be relative in hepatitis C. All right, so we've all had the flu. So let's talk a little bit about the antiviral application of nitazoxanide. So it is repurposed for different uses, including influenza. Now, this is super important and very explanatory of how nitazoxanide works against different viruses. It's super interesting to learn how this drug works. Learned so much when I was initially digging into learning more about how it works and what it does, and it's a smart drug. So it works to balance or modulate the host immune system, which is you. You're the host that would host that flu virus in your body. So it basically modulates or balances your immune system by upregulating antiviral signaling within the host cells. So it tells the host cells or your cells, hey, be on higher alert. We've got something going on. The host targeted mechanism is one of the most important things about how nitazoxanide works and is what makes it different. So if you ever had the flu and your doc said, "Hey, let's get ahead of it as quick as we can. I called you in a prescription for Tamiflu to Walmart. It's going to work to stop how bad the viral infection is progressing and your symptoms. So you have less worse symptoms or lesser symptoms when you take a drug like Tamiflu. It's also known as oseltamivir, but the brand name is Tamiflu. So, unlike Tamiflu, which prevents viral release from the cell, thiazolide, so we're talking about nitazoxanide, prevents the virus from ever being properly assembled. Viruses must require assembly. And when I was talking about the fusion and the entry of the COVID-19 virus, for example, viruses are so smart that they can disassemble so that they're not recognizable to the body because the body recognizes patterns, and then they can get in the cell and then they can reassemble. So it's very, very tricky. So nitazoxanide can prevent the virus from ever being properly assembled or even exiting your cell by interfering with something called the hemagglutinin maturation process. So if that doesn't mature, then the virus can't exit and cause issues for you. So nitazoxanide is actually active against Tamiflu resistant strains. So when Tamiflu doesn't work, we do have the option to come in and use nitazoxanide, and we would use it in the same population of people. Nitazoxanide disrupts intracellular processing of viral proteins. Again, it requires assembly. Everything's based off of proteins in the body for the most part. So if it can't process the viral proteins, then what do you get? Non-infectious particles. It also acts early in the viral replication cycle, which is why we would use it in lieu of something like Tamiflu that you're trying to use very, very early on in the viral infection timeline. Key point here, viral assembly and host response, so your response, are targeted rather than the virus itself. And this is what I was saying at the very beginning is it works differently rather than just working on the virus itself. It cues up your body and your cells and your immune system to be more receptive and more on surveillance for what's happening so that it can shut down the pathways that influenza requires to be assembled and to infect. So if you can disarm what influenza brings to the table to infect, then you can be more effective with not getting affected or infected by influenza itself. Therefore, we're also less prone to resistance. Okay, we've also all had COVID. I don't care what people say. Some people said they never got it. You got it. You just didn't know you had it. Just like everyone's had the flu, everyone's had SARS-CoV-2, which is COVID, okay? If you never thought you had it, that's good. It means that you didn't have an abrupt response to it, which is not the camp most people are in. But again, just like influenza, we do have a SARS-CoV-2 antiviral application. So it is repurposed and definitely of continued interest because COVID's not going anywhere for the COVID infection. How does it do this? It interferes with the maturation of the spike protein. So we talked back here about the maturation of hemagglutinin. This sounds all probably pretty complicated, but it's a lot about viral assembly, protein assembly, and how the heck does the virus get in the cell. If we can have an impact on what's going on the outside of the cell and disassemble this, then we have cut off the virus's ability to enter and infect the cell. And the same thing goes for SARS-CoV-2. I mean, this kind of looks similar to the past picture I was showing you, except for what we're looking at here are spike proteins on the outside, which we hear so much about in the SARS-CoV-2 or COVID infection. Spike proteins are a big darn deal, and they're not getting talked about enough. And I am a huge proponent of opening the conversation around spike proteins because I have seen the effects that they have in folks that are walking around with super elevated spike protein levels and no clue that they have them. So, what am I talking about? When we are infected by the SARS-CoV-2 virus, we will get a viral infection, but these spike proteins, when they are dislodged or released from the virus itself, they try to go for certain areas of the body to live where they will survive and where they're going to be most likely to replicate. The spike proteins, why is that a problem? They cause a lot of inflammation. They love the brain tissue. They love the central nervous system, which is your spinal cord and your nerves. And they love traveling down the nerves through the arms and the hands and the legs. And they absolutely love the fat tissue. So for those that are more overweight and carrying extra fat, spike proteins love to go to that fatty tissue and use it as a factory for replication. So if we can limit that, that's certainly ideal. But again, spike proteins cause a numerous amount of inflammation. So what happens if we have too much spike protein living in our body and too much inflammation? It can cause neuropathy, like I'm talking about, living in the nervous system. It can cause brain fog. It can cause deterioration of thoughts and memory and confusion. Majorly, something I didn't mention is it loves the reproductive organs and the reproductive tract. So infertility is through the roof. Cardiovascular issues are one of the most shocking things is the spike protein loves the cardiovascular system in the vessels and causes blood clots like nobody's business. I've seen photos of blood clots strung together when they're pulled out of the human vascular system that are several feet long. And this is what is causing a lot of the uptick in cardiovascular events for folks that have really high spike protein. So hopefully I'm driving this point home for you that I personally feel it's super important to get your spike protein checked. If you have received the COVID vaccine or any of the boosters, you're likely to have about a 10x higher number of total spike protein that can be measured in your body. And just to provide some perspective here, SARS-CoV-2 or the COVID virus is not natural to the body. So when you take a blood test and you try to measure the spike protein, it's going to say that the quote unquote normal amount that should be in there, or the normal range, if you will, it's extremely low because it's not like the body makes it on its own. It's not supposed to be there. So the normal level is anything less than 0.8, okay? People that have received vaccinations are usually at 20,000. So the difference between 0.8 and 20,000. And these are the people that are having all of the symptoms that I just mentioned. For those that are not vaccinated, they can tend to be somewhere between a few thousand to maybe 5 or 10,000. I have been testing my level about every 6 months, and I typically fluctuate a few hundred points in each direction. I like to tell people to keep their spike protein goal under 1,000. If you're under 1,000, we probably don't need to be doing anything actively about it to bring that number down. There are a lot of things that we can do to get the spike protein out. One of the options is for us to denature it or break it apart and help you urinate it out. There are different supplements that help, when used together, bind to it, deconstruct it, denature it, and help it get it out. There's peptides that help you get it out. There's IV therapies that help you get it out. There's IV therapies that can chelate it or bind it and help you get it out. So there's a lot of different options that most people have no idea what a spike protein is, why it's a problem, more or less how to get it out. But I want you to know that this is a really big deal, which is why I'm spending time on it. And your doctor might not be ordering it and might push back on ordering it. I'll make it very clear that there are different types of spike protein tests that can be drawn. You can have a lab test drawn that shows evidence that you've had a COVID infection. Who cares? Everyone's had a COVID infection. What's the point of that? It doesn't do us any good. We want to see what your total viral load is so we can see what we need to do about it. And that's what these tests are over here. Certainly, if you want to touch base with me at any point going forward to ask me what these are, that's completely fine. But actually, at LabCorp, you can now self order this test. So you don't even need a doctor to do it. You can go online and order it yourself. That's what it's called. And that's the order number for the lab as well. So back to how nitazoxanide works on the SARS-CoV-2 virus. Again, it works on your immune response, the immune response of the host. It activates genes that are responsible for antiviral activity or fighting off viruses, which play a role in defending against viruses and pathogens. It also upregulates antiviral signaling within your host cells. So again, same thing as with influenza. It's telling your cells to say, hey, pay more attention so we can fight this off and it doesn't actually cause a problem. Nitazoxanide can reverse early suppression of SARS-CoV-2 by preserving your immune response. It may inhibit the replication of this virus and also pro-inflammatory cytokines. So sometimes you hear the term cytokine storm. Cytokine storm is when you have a major inflammatory response, generally to a virus, and we usually hear about this in relationship to COVID. Also, it can help to open up the bronchioles, giving you a bronchodilatory effect or dilating the bronchioles in the lungs so that you can breathe better. And key point here is impaired spike protein maturation, meaning if we don't allow these guys to break off and keep maturing and replicating, then you're going to have reduced infectivity of the virus. And that's really the whole point, and to help control your inflammation. All right, so what about SIBO? If you've never heard of SIBO before, SIBO stands for, or is short for, small intestinal bacterial overgrowth, SIBO. Now, oftentimes what we have here is a mixed dysbiosis, meaning that there's different bacterias that are mixed, which makes it even harder to treat. SIBO is very painful and it causes a lot of gastrointestinal distress. Also, in addition to a mix of bacteria, you can have anaerobes in there, which are bugs that don't like oxygen. They hide from them, and that's how they survive and do well. It may or may not also be infected, meaning the GI tract, the gut, with protozoa additionally, as if the others were not enough. And oftentimes the symptoms are driven by anaerobic fermentation. So that's just a metabolic process. Bacteria have to consume nutrients and dispose of waste just like humans do. And so usually this results in gas, bloating, diarrhea, constipation, needing to be near the toilet. It's a bad deal. It's not an easy fix. So nitazoxanide has a broader coverage than, if you've heard of Xifaxan or rifaximin. Those are very expensive drugs, which are usually cost limiting for folks. They can't afford to be on them. They can be thousands of dollars each month for this treatment. So nitazoxanide has broader coverage, meaning that it covers more of the bad guys, more of the bugs, with activity against bacteria, anaerobes, and protozoa rather than just one. So we get broader coverage. Also, it works on that P4, that enzyme we talked about at the beginning. So it inhibits P4. It helps to disrupt the metabolism and the nutrient consumption of those bad guys, and can directly impair fermentation-driven gas production. So again, these seem like a lot of big words, but if you've had SIBO, The terms metabolism, fermentation, methanogen, hydrogen, you'll all be very familiar with because we need to know and understand what the behavior of those bacteria are so we know how to disrupt their metabolism. We can't just go in and kill a microbe. We need to know how their metabolism works so we can shut it down. And in fact, if you didn't know this, this is a lot how ivermectin works too. It works on the metabolism of the parasite or the metabolism or metabolic pathways of the virus to help shut it down. So it doesn't just kill it. It doesn't just blow it out of the water. We have to go in and get very crafty with addressing the metabolism of the bad guy. Also, something that there can be a big issue with in SIBO is biofilms. So biofilms is something that when certain bacteria, again, metabolize their nutrients and give off a waste product, that can be a biofilm. So it's just like it sounds. It's a biological film. It's like a filmy substance that is made by a bad guy, like a bacteria, for example, that almost makes it and sheds it and then deposits it somewhere in the body. It loves the mucosal linings. Biofilms can form up here in the nasal cavity as well, which can be very difficult to treat unless you use repetitive nasal sprays, which are targeted towards those specific bugs, those specific microbes or bacteria. And it's not any different for the gut. The biofilms can live there too. So that can be an issue that also overlays with SIBO. So those that have hydrogen dominant SIBO who temporarily improve with the use of rifaximin, that very common drug, but then relapse within weeks. Oftentimes, those people are carrying around certain bugs that compensate with alternative metabolic pathways. I told you these guys are crafty. The viruses can disassemble and reassemble themselves. Bacteria and other bugs can find a way to actually gain a new form of metabolism so that they can survive on the host, which is you. So nitazoxanide, however, disrupts these pathways more aggressively. And nitazoxanide covers anaerobes also involved in sulfur metabolism. So we talked about hydrogen, also sulfur, and then this can be helpful in combination therapy, meaning that we're using multiple medications for methanogen heavy presentations. So hydrogen, sulfur, methane, we talk about all these because we need to know what's actually going on. And then clinical benefits that can be observed through the use of nitazoxanide in small intestinal bacterial overgrowth is a significant reduction in those symptoms. So bloating, lessened distension, which is the feeling of it's really pushing out or stretching the abdomen following meals, improved bowel regularity, so having more consistent and better quantity and more appropriate bowel movements, fewer intolerances to foods, because you can imagine if the gut has just been wreaked havoc on, you can't really eat anything you want. So the nutrient reduction is pretty significant. Also reduced nighttime GI symptoms and enhanced bowel motility mean that things are actually moving through better. Okay, so we compound nitazoxanide in a 250 milligram capsule. At the beginning, I showed you the commercially available drug is available as a 500 milligram tablet. We make it in lesser strength than that, but importantly, our product is actually sugar and dye free. So you don't have those added ingredients in there that aren't going to be serving you. Again, this nitazoxanide is indicated for those over 1 year of age. As with many antiparasitic drugs, it should be taken with food to enhance absorption. The treatment will vary depending on what we're treating. So the duration or the length of therapy typically ranges somewhere between 3 to 14 days. And it's not like you're taking the same dose either 3 days or up to 14. You will take it a different amount of times per day. The age will change that. The severity of the condition will change that. What we're actually trying to address will change that. So there are a lot of factors. And then also common question, well, I have liver or kidney issues. Do I need to have a different dose? No, there's no considerations there for adjusting those doses. Let's talk about the safety profile briefly. So when we look at adverse reactions, pharmacists, we have access to a database that allows us to look at all the information for every drug. And part of that includes information on studies that have been published to tell us Well, how frequently is it that someone actually has headaches or abdominal pain or nausea or diarrhea or vomiting or whatever it is from said drug? So I just want to show you how low of an occurrence this is. When we talk about adverse reactions, that sounds really bad, but adverse is just something that wasn't supposed to happen necessarily as a result of taking the drug, but it's going to happen in some people. So up to 10% may experience headaches, abdominal pain, and urinary discoloration. Some of the drugs that work in this way may cause urinary discoloration. Methylene blue turns the pee blue. Nitazoxanide can turn it either a really bright yellow or sometimes almost a greenish color. I wouldn't say it's as pronounced as methylene blue, which is definitely going to make it an aquamarine or even a navy color, depending on how hydrated you are. Urinary discoloration happens in about more than 2% of people, and then diarrhea, dizziness, and rash less than 1%. So it's very low. Usually the rash is because that's a true allergy to the actual active ingredient itself. And as far as contraindications, when we absolutely not use it, it would be if you had a hypersensitivity or allergy to any specific component or ingredient in the nitazoxanide preparation. And I just wanted to show you here, because this is a common question. Within the drug database, what we consult is something called Briggs Drugs in Pregnancy and Lactation, and that is the reference for pregnant or lactating women. We need to know if that woman has to take said drug, is it going to pass through the breast milk? And if it does, is it going to adversely affect baby? Or if the woman is pregnant and she has to take that drug, is it going to cross the placenta? And if it does, is it going to hurt baby? Now, the answer to that question is usually, well, we don't know, so don't give it, because we don't have copious amounts of pregnant women saying, yeah, sign me up for that study. I'd love to see if it does something to my baby or not. So we just usually don't know. But in this case, we do have some information showing that based on animal data, there's not a probable risk. And so we assume for it to be likely compatible for those that might be pregnant or breastfeeding, meaning that it shouldn't pose significant issues for safety. Now, when should we consider nitazoxanide? If you have treatment refractory SIBO, meaning you've tried all the other stuff, there are a lot of different approaches to SIBO. Sometimes it's heavily herb based, so a lot of high dose herbs that can be used in SIBO. Also, high dose antibiotics. I talked about Xifaxan or rifaximin is probably the most common, but again, it's very expensive. Also, and so if it hasn't worked or if it's relapsed, that's what we talk about there. Or if you've got SIBO plus some sort of protozoal overlap, mixed dysbiosis, which is the combination of different bacteria in SIBO, biofilm associated gut infection, poor tolerance or response to that rifaximin or Xifaxan, or maybe you do well at first, but then it relapses in a few weeks. Repeated prior antibiotic exposure. So this is a tough one because you may be on antibiotics repeatedly, not just for gut issues, but for other issues as well. The catch-22 with antibiotics is the more you take, the more it's going to rip up your gut, and then you have to spend time repairing it. But the weaker that your gut is, the harder it is for you to fight off infection. So that's why we like to tread lightly with these guys here. SARS-CoV-2 infection, influenza we talked about, and then of course, back to its original use, treatment of parasite-associated diarrhea, which in the United States of America, we don't usually think about that too much unless we are traveling to underdeveloped countries, but it doesn't just have to apply to that situation either at all. We can still be exposed. So just to show you here that we have a lot of evidence historically to stand on for nitazoxanide, but there is definitely much more desired and in the making. So we see that it can be used here. These are just journal excerpts as an antiviral agent, as a potential drug for eradicating or getting rid of H. pylori, also for Hep C virus resistance, also for C. diff. And that's not something I mentioned, but if you've ever known someone that's had C. diff or you've had C. diff, it is one of the worst infections you can possibly get. And if it's not intercepted quickly, you can die from C. diff. And it's very difficult and very expensive to treat, and it has to be treated in the hospital. So that's pretty interesting that we have an option for that as well. And then we talked about the cryptosporidial diarrhea, so that's back to the parasitic infections. Now, we also see that it can help potentially in ulcerative colitis. And lastly, here is just an excerpt of something that we look for if we're looking for ongoing studies or existing studies. Because as the public, we have the option to try and enroll in drug studies. And so this is a snapshot from a website called clinicaltrials.gov, which is where you can always go. I don't really know why you would, but you can always go there and you can see what active studies are being ran. If what it is, so for example, nitazoxanide in patients with metastatic colorectal cancer, COVID-19, hepatic encephalopathy, ulcerative colitis, H. pylori in children. All of these, the status is recruiting. So these are all ongoing active studies right here. It'll tell you what the condition is that they're treating and then the interventions, aka the drug that you're using. So sometimes it's just the nitazoxanide alone, I can see. Other times it's in combo with drugs like rifaximin or clarithromycin or metronidazole, and they want to see if combination therapy will be perhaps effective. Here are my references. And as usual, everything I have to talk about, because on behalf of the pharmacy, is going to require a prescription. But certainly, if you have questions about this one, our website is here, our phone number is here, my personal email is here, which is very long. And then, of course, if you want to just call the pharmacy directly and chat with me or any one of our pharmacists, we'll be happy to take care of you, happy to request a prescription and communicate with your physician about that. If you saw anything on here that applies to you, such as influenza or COVID or SIBO or anything else that was listed that you think may be affecting you or you have been affected by or it's difficult to treat, then of course, give us a call, drop us a note or a question, and we'll help sort that out with your physician as well if this is appropriate for you. So I will go ahead and stop sharing now, and we'll see if we've got any questions. If you have questions, you can drop them in the chat. And I do have a question here saying, does testing your spike protein help with long COVID symptoms and treatment? In my opinion, absolutely. There are a handful of long COVID, quote unquote, long COVID clinics around the country that specialize in this type of thing. And most of them are doing that type of spike protein testing, which is just, evidence to the answer of your question is that yes, it's important. But again, we don't want to run a test that is just looking at the proof of past infection because, we've all had it, right? We want to know what the total viral load is, so we need to know how aggressively we can treat that. Long COVID is a very complex condition and it looks very different for everybody. So a lot of people have a strong overlap with mast cell activation syndrome, which we've talked about, which also wreaks havoc on the cardiovascular system. We're seeing a lot more POTS, dysautonomia, brain fog, thyroid issues. So all of that can overlap. It's just in what capacity does it actually do that where it's causing the issues. So a short answer to your question is yes. And I'm a huge proponent of getting that tested. It's very inexpensive. In Texas, it's, I want to say about $50 cash pay, which I just pay out of pocket for it. And I test that every 6 months because I want to check and see what is the trend. There are different ways that you can be exposed to spike proteins, by the way. If you've heard about spike protein shedding, there's different ways that you can be shed on. You can be shed on by going to the grocery store and coming in contact with somebody who has coughed. Also, if you work in the healthcare field like I do, you may have a higher likelihood of being exposed to patients, of course, that are carrying that. And then lastly, something that is not usually talked about but should be and needs to be addressed with couples is spike proteins are highly shed through sexual contact. And so, unfortunately, a common thing that I see is that you've got one spouse that is vaccinated, one that is not, and the one that is not vaccinated is the one that wants to treat for the spike proteins, but their spouse that is vaccinated does not want to treat their high spike proteins. So this is just a common downward tailspin because they are sharing spike protein, shedding it, and on top of that, they're living in the same house. So back when you think back when there were quarantines that were happening, you don't want to expose yourself to multiple people. So you're in those close quarters with your family, you're more likely to shed within the family or whoever is living in the home. So that can be very difficult. So you can't just think about the one person either. You also need to think about who's in your environment and if sexual exposure should be an element to be addressed. That's not really addressed or talked about probably as much as it should. So it's not just the individual that we're treating. So hopefully that clears that up a little bit, but that's an excellent question. And we'll see if we have anything else here. I'd include information for pricing, which I usually get questions about that, but we can quote that for you because actually it's going to be quite a range anyway. It largely will depend on how long you're going to be treated for. So the older that the patient gets or the more severe that the issue is, that's when the duration of treatment gets longer. It's usually looking at somewhere between 1, 2 times a day. For severe SIBO, you might look like a commitment of 3 times a day for about 10 days. So these are fairly short courses of nitazoxanide. It's not something like ivermectin where we can go every single week as long as we want, basically, or in some cases, we use that every single day ongoing. So, all right. Well, I want to thank you guys so much for tuning in with me today. We'll see you back in about 6 weeks for our next topic. And if you have any questions, please do not hesitate to reach out. And we look forward to talking to you soon. Take care.